Hello, this is Aksar Haribov, and I'm here at Digital Health Summit studio, and today I'm joined by Rick KATES from J&J.
Hi, Aksar.
Hi, Rick. So tell me, what are you most excited about in the digital health space?
What I'm most excited about in digital health is that we are transforming from point solutions to much more of an ecosystem kind of view. And if you go back 20, 25 years to when diabetes management software started to become popular, there was a very small percentage of people who would look at that data and try and make sense out of that data. The challenge has been that the disease has progressed to the point where there are more than 420 million people around the world who have diabetes today.
Wow.
That continues to increase at a massive pace. Our healthcare system can't afford to treat those people the way they need to be treated. I think the latest statistic that I saw was that approximately 50% of those people are uncontrolled or unaware of their diabetes. It's a huge problem. I come back to the diabetes management software, and that software is being used by people who are quote unquote techie.
Yep.
They're interested in managing their diabetes. They're probably benefiting for sure, but they're not the people who are going to benefit the most. And what we've started to do now is we've started to look at developing solutions that are not just about data and presenting data, but about taking that data and presenting it in the form of insights, actionable insights that people can take and make sense of and understand the context for, so that the 99% of the time that they don't have access to a healthcare professional, they are able to self-manage more effectively.
That's very exciting. I mean, I think all the things you said is correct. It's a growing epidemic, and it's not stopping. So what you're saying is J&J is coming in and saying, okay guys, not only do you get the device, we'll also come up with something that you can use at home to better manage your care.
And the reason why J&J is really excited about this is because we have the capability, we have the brand equity, we have the market access, we have the customer insights, we have very deep understanding of the disease state all the way through from pre-diabetes with our health and wellness solutions to type 2 diabetes, where blood glucose monitoring is the standard of care for episodic monitoring of your blood sugar.
Yep.
Insulin delivery devices, we have both durable pumps as well as on-demand, discrete mealtime dosing that we are launching in the near future. And we have oral therapies, SGLT2 oral therapy in Bocana, as well as a presence in bariatric surgery. So diabetes is at the core of what we are doing within J&J, and so it's very important for us to look at the disease holistically, the patient journey across that disease, and try and figure out where we can intersect, where we can intervene and make a difference to drive sustainable outcomes. And that's why point solutions are very, very challenging. When you look at things much more holistically, you look at the patient in their totality, you can develop a much more robust ecosystem.
That is true. I mean, so if you are, a diabetic and you're interested in basically doing better in your health, what are some of the things they can look forward to with J&J, who's a fairly well-known brand to them?
Absolutely. One of the things that's really exciting about what we're doing is that we're really transforming information technology. And historically, information technology was the plumbing and wiring behind everything that happened. It wasn't that exciting. But what's happening now within J&J is that information technology is really transforming into health technology. And health technology means things like robotics, like 3D printing, like artificial intelligence, like machine learning, data analytics, wearables, sensors. All of that is coming together and is presenting a really unique opportunity to personalize, to take data that is typically historical and make it potentially predictive and prescriptive in a very individual way by taking all that data, and J&J has a huge amount of data. I heard that J&J currently has approximately 500 terabytes of data.
Wow.
And so anecdotally, I also heard that that's about 2.5 times the amount of data that the IRS has. So you can imagine if we're able to harness all of that data and turn that into insight for any individual, that we can have a tremendous impact on their outcomes. And that translates to efficiency and effectiveness for a healthcare professional, as well as for the payers who are trying to manage not one individual, but populations of individuals. So think about it in terms of tools for risk stratification and driving outcomes at a population level.
It sounds like you guys are doing some really good work. Well, thank you, Rick. This is Aksar Haribov coming to you live from Digital Health Summit Studio.